It is indeed a great honor to have the opportunity to reflect with you and other colleagues on who has actually got the back of our healthcare professionals in Africa as our healthcare professionals care for others within this time of a global pandemic. Today, we will hear the story of a Ghanaian doctor that succumbed to COVID-19, reflect on how his story connects to each of us, and leave with 5 key lessons on how to prevent and manage the risky and stressful working conditions faced by our gallant frontline healthcare workers every day. Dr. Harry Boateng was young, only 48. He was, until June of 2020, the medical director of the Kwadaso Seventh-day Adventist Hospital, located in the Ashanti region of Ghana. He was loved by his patients and colleagues. In fact, he often went beyond the call of duty in his quest to provide the best for his patients. Sometime in June of last year, he felt a little unwell. He quarantined at home while awaiting his COVID-19 test results. His situation worsened, and he was found dead in his bed one morning. His COVID-19 test subsequently came back positive after he had passed. Within 8 days of his death, ladies and gentlemen, Harry Boateng's elder brother also succumbed to the infection. He was apparently involved in Harry's care. In the twinkle of an eye, the family lost 2 brothers in the prime of their lives, one a doctor and the other a local government official. As improvers, we might ask, what really killed Harry? We might conduct a root cause analysis with follow-up actions that highlight the quality of his care at home, the time it took to get his test results back, and the rapid response mechanisms that could have been deployed when his situation rapidly deteriorated. We might also reflect on his personal circumstances, the reported comorbidities, a tired district-based doctor who had perhaps never even taken a vacation with his family before. Eventually, the pathologist will tell us that our colleague, friend, and pediatrician, Dr. Harry Boateng, died from simply being a highly qualified and passionate professional working in a flawed health system and overcome by a little-known disease. The question I would want you to ponder over, ladies and gentlemen, is whether Harry's situation, his risky working conditions, the response of the health system when he was most vulnerable, and his own awareness of his susceptibility were unique to him or not. I would argue that Harry was not unique in that regard, and that each day we are each faced with similar high-risk environments that exact a huge demand, especially on our health, way before we eventually succumb. I would also argue that as Africans, one of the most neglected areas of our care is the toll of our work on our own mental health. In fact, in certain cultures in Africa, so high is our tolerance for suffering that complaints about stress, chronic fatigue, and depression are likely to be dismissed as the rantings of a lazy person. We simply don't see it. In fact, ladies and gentlemen, an evaluation of the mental health impact of COVID-19 on patients, the general public, and healthcare professionals concluded that the pandemic has led to a high mental health burden, especially among healthcare professionals. Knowing this, how do we recognize and urgently manage this critical public health issue? Dr. Demise, one of the foremost improvements, takes it a notch further by arguing that people are actually entitled to joy in their work, making the joy of the healthcare workforce the overall aim of managers of our healthcare systems. Dr. Harry Boateng could not have had joy when his COVID-19 test delayed and arrived only after he had taken his last breath. He could not have had joy if his hospital regularly ran short of personal protective equipment and oxygen, and he could not have had joy if he could not be sure when he would be vaccinated against COVID-19. Similarly, Dr. Boateng could not have joy in his work if his employers had no risk allowance for him, and where risk allowance existed, if the management regularly defaulted in paying him in order for him to take care of basic needs while spending crazy long hours at work. I want to speak a little bit about moral injury, because in one instance of moral injury, a colleague at the forefront of the COVID-19 management lamented to me about how she felt that by having to choose between who to put on a ventilator and who not to, who to refer and who not to, quote and unquote, waste time referring because that patient stood no chance whatsoever, she sometimes felt she was sort of having to decide who should live and who should die. This became her burden at the height of the second wave of the pandemic, when patients were queuing in her hospital for oxygen seated in chairs. Are you able to recognize when you are stressed? Are signs like poor sleep, fatigue, avoidance and procrastination, forgetfulness and pessimism, outbursts, angry outbursts, and feeling overwhelmed all too familiar? What happens when stress at the workplace becomes chronic, leading to burnout? You feel emotionally exhausted, have negative feelings about your work with a reduced professional effectiveness. The impact is a greater likelihood of medical errors, our patients leave less satisfied, and there's a high staff turnover. As experts point out, burnout is more than just an employee problem. It is an organizational problem that requires an organizational solution. These organizational solutions must necessarily tackle three things: the basic needs, that is addressing food, water, rest; the psychological needs, connecting with people and building intimate relationships at work; and finally, creating environments that enable staff to achieve their full potential at work. Having diagnosed the issues, what actions can we take now? First and foremost comes the individual responsibility. We need to change our thinking around certain deeply held beliefs that ultimately harm us, ladies and gentlemen. We need to shift our thinking from mental models that automatically assume that if you get more money and if you get more benefits from a very stressful work, it will be an answer and a solution for everything, irrespective of how tired you are. While higher remuneration is certainly important, it is not sufficient. We do need to embrace newer mental models that push for more meaning, greater purpose, camaraderie, or solidarity among colleagues, and better health outcomes for our patients and families. At a very personal level, we each have a primary responsibility to exercise self-care. And self-care means that we need to take deliberate actions to care for our physical, mental, emotional, spiritual, financial well-being. Basically, take care of yourself as you would your child. As we say, if you drop dead today, you will be replaced tomorrow. Indeed, Dr. Harry Boateng has been replaced as the medical director in the Seventh-day Adventist Hospital, and life is going on as it should. Self-care may mean going for massages, taking a vacation, which is an alien concept to many who go on leave to do locums. Ladies and gentlemen, taking your leave in order to use the free time to do some more work is what some of us are engaged in. Self-care may also mean deliberately choosing to spend more time with family, undergoing frequent, thorough medical checkups, exercising more, or taking new courses to advance your career. Some are too busy to even make use of professional development funds put aside by our organizations, thus limiting our own career advancement. This brings us to the first lesson that I would want to point out, which is that we need to reframe, change the way we are thinking about these things, and prioritize our care. We shall now focus on those interventions that can be promoted by healthcare managers and leaders. Huddles are a simple technique used on IHI Staffcare Project in South Africa and in hospitals like Nyaho in Accra, where management and multidisciplinary teams come together, huddle briefly to surface top-of-mind issues and problem solve together. This is an opportunity for honest and transparent conversations. Some of these huddles have kick-started interventions like flexible work patterns, support with data for internet access, training in new skills, rapid supply of essential equipment, and possible support for childcare and housing should staff need to be quarantined at some point. In a survey administered on our staff care project, 70% of staff admitted that the huddles did make them feel supported and protected. Our second lesson, ladies and gentlemen, is that it is important that we proactively manage fear and anxiety in the daily work, especially in a time of crisis like this. Also, to understand what matters to staff, managers in the Western Cape province administered an emotional well-being survey and, more importantly, acted upon responses provided by the staff. My favorite question on the survey is, I worry that I or my family will get COVID because of my work. Many other tools for measuring staff well-being exist, and it's important that we leverage these tools. This brings us to the third key lesson that I would want to make, which is that it is important that we implement measurement plans to elicit timely feedback on staff well-being, and most importantly, be open to and to act on the feedback that is received. The Royal Free Hospital in London had a high turnover of staff, something in the region of 48% recently, and set out to reinforce teamwork and support new staff. Their data showed a lot of staff were considering leaving by developing, testing, and implementing various ideas around coffee catch-up with matrons, connecting with a matron to troubleshoot and to share your concerns, increasing the number of shift choices so that staff were not stuck with stressful 12-hour shifts forever, by celebrating Employee of the Month and starting an electronic system for requesting shifts. They halved the turnover rates among the nursing staff. This again brings me to the fourth lesson, which is that it is critical to ensure psychological safety and provide optimal mental health well-being support. Especially in times of crisis, healthcare leaders need to aim at building a psychologically safe environment where individuals feel safe speaking up about risk or discussing fears openly. These fears may relate to inadequate numbers of hospital beds or ventilators. It could be concerns that colleagues have about the absence of PPEs or protocols around repeat use of face masks, etc. Leaders can achieve a lot by being humble, admitting that you don't know it all, by being curious to listen to other colleagues, and exercising empathy in taking the requisite actions. Also, it is important to recognize and communicate to staff that their mental health and well-being are vitally important. As a leader or team member, it is okay to be vulnerable and to speak about your own experiences within the crisis. Finally, I would say that others who have tried this and access some of these services have found it very beneficial to create access to mental health support or treatment for all staff and management. In this COVID era, clinicians face what has been described as moral distress, defined as knowing the right thing to do, but facing constraints that make doing it nearly impossible. To help clinicians acknowledge these experiences and find comfort knowing their peers feel the same way, Johns Hopkins University introduced what they call moral resilience rounds. Typically, for 1 hour every week, a group of multidisciplinary clinicians will meet, mostly virtually, to discuss recent ethical challenges. These rounds serve two purposes. One, provided a space for the distress caused by the ethical challenge to be acknowledged, and secondly, to to enable the team as a whole to pivot to solutions. Our fifth and final lesson emphasizes the need to create opportunities for staff to reconnect with meaning and purpose in their work. By framing and prioritizing our care, by documenting staff well-being, by managing fear and anxiety in a psychologically safe workplace, and connecting the core purpose, primarily because we are all here to do good, Harry Boateng's death will not have been in vain. He would rest in the knowledge that we are going to take better care of ourselves and of each other. Let's do this again next year. Until then, we can only box on. Let's go out and continue making a difference. Thank you so much for your attention.